Right now, without changing anything, feel the back of your neck near your shoulders. If there's a firm ridge or bump where your neck meets your upper back, that's not just posture. That's a structure pressing on the blood vessels that feed your brain. And here's the part most people miss entirely. That bump can start forming in your 20s, not your 60s, not after menopause, your 20s. If your daily life looks anything like most people's today. If you want health information explained this clearly and this honestly, subscribe and hit like. It helps more people find this channel, and the goal is 200,000 subscribers. You're part of making that happen. Health checklists and short posts are waiting for you on my Telegram. Scan the QR code on screen right now. Let's start with something you probably learned in school and immediately forgot. Your spine is not a straight rod. It has 4 natural curves. There's the cervical lordosis. That's an inward curve at the neck. Then the thoracic kyphosis, a gentle outward curve between your shoulder blades. Then the lumbar lordosis, inward again at your lower back. Then the sacral curve at the base. These 4 curves work together like a spring system. They absorb shock when you walk, run, or lift something heavy. When those curves shift, when one gets exaggerated or flattened, the whole spring stops working properly. Load gets concentrated in the weakest points, and things start to break down. The neck is one of those weak points. 7 vertebrae stacked on top of each other, holding up a head that weighs about 11 pounds. 11 pounds sounds manageable, until you understand what happens when that head shifts forward. Biomechanical measurements show that when your head tilts forward just 15 degrees, the kind of tilt you make when you glance at your phone, the effective load on your cervical spine jumps to about 26 pounds. At 30 degrees, it's roughly 40 pounds. At 60 degrees, the angle many people hold when reading in bed with a phone above their face, the load reaches nearly 60 pounds. That's almost 6 times the normal weight, every day, for hours. Your neck muscles were not designed for that. Nobody's were. So what exactly is the bump? Medically, it's a dense accumulation of fat and connective tissue that forms over the 7th cervical vertebra, the last vertebra of the neck. You can find it yourself right now. Tilt your head forward and feel for the most prominent bony point at the base of your neck. That's C7. In a healthy spine with good posture, there's nothing over it but skin. The bump, sometimes called a Dowager'S Hump or widow's hump, forms when chronic muscle spasm, impaired blood flow, and sluggish lymphatic drainage all combine in that zone, and fat tissue begins to accumulate there. The name widow's hump comes from a real historical pattern. This problem was most commonly documented in women going through menopause. And there's a clear physiological reason for that. During menopause, estrogen levels drop significantly. Estrogen, the primary female sex hormone, doesn't just regulate reproduction. It also governs where the body stores fat. When estrogen is at normal levels, fat tends to deposit around the hips and thighs. When estrogen drops, fat redistribution shifts. It moves away from those areas and starts accumulating in the abdomen, the upper arms, and the upper back, including the base of the neck. This isn't a lifestyle failure. It's a hormonal shift that changes fat metabolism at the cellular level. But here's what's changed in the last 2 decades. You don't need to be in menopause to develop this. You just need a desk, a phone, and a few years. Clinicians are now seeing this in people in their 30s, their mid-20s, and sometimes younger, equally in men and women. The driver isn't hormones. It's 8 to 10 hours a day in a forward head posture, followed by more hours on a smartphone. The muscles holding that position eventually stop releasing. They lock up. That lock state has a name: chronic muscle spasm. A muscle in spasm isn't just tight, it's failing to relax even when you're not actively using it. It's metabolically active, consuming oxygen and nutrients, while simultaneously squeezing the blood vessels and lymphatic channels that run through it. The upper trapezius, the large muscle that runs from the base of your skull down to the middle of your back and out to your collarbone, sits right over this zone. When it's in chronic spasm, local circulation gets choked off and lymphatic drainage stalls. Lymph is the fluid responsible for clearing metabolic waste from your tissues. When lymph can't drain, the area becomes congested. inflamed, waterlogged, and prone to fat accumulation. That's how a firm, sometimes tender ridge forms at the base of your neck. In the early stages, you might notice it as a vague heaviness in your neck and shoulders, crunching or clicking sounds when you turn your head, and those are not normal. That's a sign the joints in your cervical spine have lost their normal movement mechanics. Headaches start appearing, usually at the base of your skull or at the temples. Ringing in the ears, trouble falling asleep. Sometimes, and this surprises people, blood pressure that keeps creeping up, that doesn't fully respond to medication because one contributing factor is sitting right at the base of your skull. There's a well-documented pattern in primary care that illustrates this perfectly. A patient, let's call her Carol, a 52-year-old office manager from Ohio, came in repeatedly for tension headaches and mild hypertension. She'd been on antihypertensives for 2 years with inconsistent results. A thorough physical exam revealed a pronounced hump at C7, significant trapezius spasm, and restricted cervical range of motion. Once her care team addressed the cervical component through physical therapy and targeted exercise, her headaches reduced substantially and her blood pressure readings stabilized more consistently. The hump had been an overlooked piece of her cardiovascular picture the whole time. Here's why that connection exists. Running alongside your cervical spine are the vertebral arteries. These vessels travel upward through the vertebrae and supply the posterior parts of your brain. The cerebellum, which coordinates your movement and balance, the brainstem, which controls your heart rate and breathing, and the occipital lobes, which process vision. When the tissue around C7 is thickened and the surrounding muscles are in spasm, these arteries can be compressed or kinked. Less blood flow to those regions means less oxygen and glucose delivered to the brain. That's not a small thing. Medical records from vascular neurology practices document a correlation, not a guaranteed causation in every individual case, but a recognized pattern between significant cervical hump formation with chronic circulatory compromise and declining cognitive function. Memory lapses, difficulty concentrating, reduced capacity for planning and multitasking. Separately, a common complaint in these cases is numbness in the fingers, particularly at night, caused by nerve root compression in the cervical spine. A patient wakes up with hands that have gone numb, runs through a series of cardiac tests, and the answer turns out to be in their neck. In advanced cases, when the intervertebral discs, the cushioning pads between each vertebra, have been chronically overloaded for years, they can herniate. That means the disc bulges beyond its normal boundary and presses directly on nerve structures. That scenario often ends in surgery. This is why ignoring it early is the wrong strategy. The good news is that 3 specific exercises, each targeting a different part of the problem, can interrupt this process, reduce spasm, restore circulation, and retrain the muscles that are supposed to be holding your posture. These are established movements from rehabilitative medicine, not internet trends. That said, if you already have a diagnosed condition in your cervical spine, a herniation, vertebral instability, or significant degenerative changes, it's worth running these by a neurologist or a physical therapist before you start. The first exercise is called a chin tuck, and it's one of the most well-validated movements in cervical rehabilitation. Physical therapists use it constantly. Its target is the suboccipital muscles, a group of short, deep muscles that attach directly to the first 2 vertebrae of your neck, just under the base of your skull. When your head lives in a forward position day after day, these muscles are chronically shortened and contracted. Their spasm is a primary source of occipital headaches and that heavy, pressurized feeling at the back of your head. Here's how to do it. Stand up straight. Let your shoulders drop naturally. Imagine a thread attached to the crown of your head, gently pulling you upward. Place one finger lightly against your chin, not pushing, just marking the spot. Now draw your chin straight back, away from your finger, as if you're trying to make a double chin. The key here, your head does not tilt back and does not nod down. It moves purely horizontal, backward. Your shoulders stay still throughout. Hold for 3 seconds. Return slowly. Repeat 10 times. You may feel a gentle stretch at the base of your skull. That's normal and expected. If you feel pain or dizziness, stop immediately. What this does mechanically, By drawing the chin back, you decompress and elongate the suboccipital muscles and shift the cervical spine back toward its neutral alignment. Done consistently, this retrains the position your head defaults to. Muscle memory is the problem, and muscle memory is also the solution. The second exercise addresses something most people overlook when they focus on a neck problem: the thoracic spine, meaning the mid-back between your shoulder blades. Your neck and your mid-back are not separate systems. They're one continuous mechanical chain. If your upper back is rounded forward, which for most people who sit at desks it is, your neck has no choice but to jut forward to compensate. Working on the neck alone while ignoring that forward curve is like trying to straighten a crooked picture by adjusting one corner. You need to open the chest. Stand straight, shoulders back and down. Interlace your fingers behind your head with your elbows pointing forward. Now slowly draw your elbows back as far as comfortably possible while simultaneously pressing your shoulders down and back. Feel the stretch across your chest and along your sternum. That's your pectorals lengthening. Hold for a few seconds. Then slowly bring your elbows forward, keeping your shoulders dropped, and feel the stretch across your upper back between the shoulder blades. Repeat 10 times. This returns your shoulder blades to their anatomically correct position, lengthens the shortened chest muscles that are pulling your shoulders forward, and releases tension in the exact area where the hump forms. One critical detail: your shoulders must stay down the entire time. The most common mistake is letting the shoulders rise as the elbows go back. That takes the work off the muscles you're trying to target and makes the exercise far less effective. The third exercise shifts focus from stretching to strengthening. Your postural extensor muscles, the ones that hold your spine upright, weaken when you spend years in a slouched position. Not because anything is wrong with them, but because they simply haven't been doing their job. The passive structures, ligaments, and tendons have taken over that role, and that accelerates the postural collapse. Hands interlaced behind your head again. This time, instead of spreading your elbows wide, press your hands backward, away from your skull, while keeping your elbows in place. Feel your upper back activate and your shoulder blades draw toward each other. Hold for 1 to 2 seconds. Return. Repeat 10 times. The movement is small, but it directly engages the deep extensors, the rhomboids, and the middle fibers of the trapezius, the exact muscles that go quiet when posture breaks down and need to be brought back online. Run through all 3 exercises in sequence. It takes 5 to 7 minutes. Most people feel a noticeable reduction in neck tension and a sense of ease in their head movements immediately afterward. That's not placebo, it's the direct result of improved circulation in the cervical region. Now, a word about massage. Targeted work on the hump zone is effective for breaking up the spastic and fatty tissue. But there's an important warning here. Aggressively self-massaging the area over C7 without proper knowledge of the anatomy is not safe. Major vascular and neural structures pass through that zone. Applying the wrong pressure in the wrong direction can intensify spasm, compress nerve roots, or disrupt blood flow. There are documented cases in clinical settings where patients who aggressively self-massage this area came in afterward with worsening hand numbness and intensified headaches. Exactly the opposite of the intended effect. If you want effective manual work in that zone, it should be done by a professional who understands cervical anatomy and has experience working with the neck. If regular professional massage isn't accessible, vacuum massage devices are a reasonable alternative. They stimulate lymphatic flow and local circulation without deep pressure on the underlying structures. Start at the lowest intensity, avoid pressing too firmly, and expect visible redness afterward. That's normal increased blood flow to the surface called hyperemia, and it fades within an hour. Pain, numbness, or significant discomfort are signals to stop. The third pillar is nutrition, and it's the one people most consistently underestimate. The hump is not only a muscular problem, it has a genuine fat component. And if the diet doesn't change, the fat layer keeps building even as the muscles improve. Exercise and massage alone will plateau. 4 dietary shifts are worth discussing with a doctor or registered dietitian, particularly if you have any underlying conditions like diabetes, thyroid disorders, or lipid abnormalities. First, fiber. Dietary fiber, found in vegetables, fruits, legumes, and nuts, doesn't digest in the small intestine. It ferments in the colon, feeding beneficial bacteria, reducing systemic inflammation, slowing the absorption of sugar and fat, and extending satiety. All of that contributes to better weight regulation and reduced visceral and subcutaneous fat accumulation, including at the neck. Second, complex carbohydrates. Slow cooking oats, buckwheat, brown rice, whole grain products, these digest slowly, producing a gradual, sustained rise in blood glucose rather than a sharp spike. Spikes matter because they trigger surges of insulin, and chronically elevated insulin promotes fat storage. Slow carbs avoid that mechanism entirely. Third, protein at every meal. Protein is the raw material your muscles need to repair and grow. Without adequate intake, the muscles you're trying to strengthen through exercise won't recover and rebuild. Protein also has a high thermic effect, meaning your body expends meaningfully more energy digesting it than it does digesting fat or carbohydrates. Sources include meat, fish, eggs, cottage cheese, and legumes. Fourth, reducing simple carbohydrates and saturated fats. White bread, pastries, sweetened beverages, and heavily processed snack foods produce rapid blood sugar spikes, rapid hunger return, and efficient fat accumulation. That doesn't mean eliminating everything enjoyable permanently. It means that if these foods make up a significant portion of your daily intake, gradually displacing them with the foods above is likely to have a measurable effect, especially on the fat component of the hump. People sometimes say, "I barely eat anything but the hump won't shrink." That's a recognizable pattern. Fat in the cervicothoracic region, especially after hormonal shifts, responds more slowly than abdominal fat. It requires consistency across all three approaches: movement, manual therapy, and nutrition working together over time. After 40, muscle mass starts declining at a measurably faster rate. Hormonal changes accelerate the fat redistribution process, and the hump tends to form and progress more aggressively in that age group. How old are you? Drop your age in the comments. Understanding the age profile of this audience helps make future episodes more targeted and directly useful to your specific situation. Here's what to take away from this. The cervical hump is not a cosmetic quirk. It's a marker of chronic postural dysfunction, sustained muscle spasm, and compromised blood flow through the vessels that supply your brain. Early on, it shows up as neck tension, headaches, ringing in the ears, and sleep disruption. Left unaddressed, it can progress to nerve compression, hand numbness, worsening cognitive symptoms, and in advanced cases, herniated discs requiring surgical intervention. The 3 exercises covered here are a sound starting point, grounded in rehabilitative practice. But if the hump is already well defined, a visit to a neurologist or orthopedic specialist first makes sense to assess the current state of your cervical spine, rule out structural changes, and get recommendations tailored to your specific anatomy. Exercise is a complement to medical evaluation, not a replacement for it. Use what you've learned here to ask better questions at your next appointment. This information is meant to inform that conversation, not substitute for it. If this gave you something real and useful, hit subscribe and leave a like. That's what keeps this channel growing toward 200,000 subscribers. Scan the QR code on screen right now to find my Telegram, where health posts and practical checklists go out regularly.